Hi, ladies, please stand by. We are live. I'll give you the instruction in about 2 minutes, but we are live now. Thank you for your patience. Apologies again. Okay, ladies, we are good to go. We can start with the program now. Let's just have persons. I see persons coming on. It's about 3 persons speaking now. So we can probably start at 6:15. Apologies again for the delay. We are live.
Can we send the link in WhatsApp, please?
Sure, no problem. We'll pull it and send it over, sure.
I have one there. I was waiting in YouTube, so maybe I'm one of those people you're seeing.
Thanks, bro. Problem. We'll pull it and send it over, sure.
Marita just sent it in the foundation's WhatsApp.
I have one there. I was waiting in YouTube, so maybe I'm one of those people you're seeing.
Same here.
Thanks, bro. Problem. We'll pull it and send it over, sure.
Marita just sent it in the foundation's WhatsApp.
I have one there.
Thanks.
Was waiting in YouTube, so maybe I'm one of those people you're seeing.
Same here.
Thanks, bro.
Good evening, everyone. We will be joining you shortly, just having some technical difficulties. We'll be with you in just a moment. All right. So let's start. Good evening again, everyone. My name is Alicia Turner, and I'm an executive member of the Sickle Cell Support Foundation of Jamaica, and I'll be your moderator for this evening's program. Thank you for joining us for our annual Sickle Cell lecture. First, I must apologize. We had a significant delay due to technical difficulties. I'm sorry.
Good evening again, everyone.
I'm sorry. Technology. So due to technical difficulties, we had some unforeseen delays, but I thank you for your patience, and we promise we have a very exciting program for you today. As many of you are aware, September is Sickle Cell Awareness Month, and throughout which we have been doing several activities to promote awareness of sickle cell disease. As usual, we launched the month with a church service, and throughout the month on our Instagram and other social media sites, we have been hosting a series of live conversations amongst persons living with sickle cell disease, or what we otherwise refer to ourselves as sickle cell heroes. As I too am a person living with sickle cell disease, I can strongly say that the term sickle cell hero is quite fitting for us, as every single day of our lives, from birth, we fight this illness, having to mitigate against several chronic and acute complications. Our month schedule also included a very informative symposium focused on the most common symptom of sickle cell disease, which is pain. The symposium highlighted causes of sickle cell pain and, importantly, the treatment, including how healthcare providers and others should manage persons with, for example, frequent hospital visits because of pain. Unfortunately, awareness of sickle cell disease is still shrouded by many myths and misconceptions. We have a saying in our society that ignorance is bliss, but we are here today for today's lecture to categorically state that ignorance is not bliss, and we will hear all about what we need to know about sickle cell disease. However, quickly before we continue, I invite Dr. Kathy Ann Williams, who is the Non-Communicable Diseases, or NCD for short, Risk Factor Program Development Officer in the NCD and Injury Prevention Unit at the Ministry of Health and Wellness. Dr. Williams, kindly lead us in prayer.
Thank you, Ms. Turner. Let us pray. Dear Lord, thank you for the opportunity to come together once again to raise awareness around sickle cell disease, a condition that is prevalent in our nation. We pray for your covering over this session as we share knowledge on sickle cell disease to the people of Jamaica. Bless the hands of our healthcare workers and caregivers for the people of Jamaica, and in particular, persons living with sickle cell disease. Give them wisdom as they provide care for those who need it the most. We pray for understanding for all the listeners today and those who will listen to this session in the future. May this knowledge be used indeed for power, and may our culture continue to be engendered for knowing our numbers and knowing our statuses. Bless the hands of all the stakeholders that work to improve the lives of persons living with sickle cell disease. The Sickle Cell Technical Working Group, the Sickle Cell Unit, the Sickle Cell Support Foundation of Jamaica, and all representatives from associated ministries, departments, and agencies. Bless our keynote speaker, Professor Jennifer Knight Madden, as she shares with us shortly. Thank you for your many blessings. These things we ask in Jesus' name, amen.
Amen. Thank you for that resounding prayer, Dr. Williams. So without further delay, we go right into today's program, and I invite my colleague, co-founder and vice president of the Sickle Cell Support Foundation, Ms. Maurette Wright. Maurette, good evening.
Thank you, Alicia. Good evening, everyone. Welcome, welcome, welcome. It's our pleasure to have you all joining our annual sickle cell disease lecture, focusing on the topic, Ignorance is not bliss, what we should know about sickle cell disease. We expect an informative and insightful lecture. Please invite someone to join. Let me acknowledge our Master of Ceremonies, Miss Alicia Turner, executive member of the Sickle Cell Support Foundation, and she's doing a great job. Allow me to acknowledge and welcome our partners who are collaborating and leading the charge in formulating and executing strategies to increase knowledge and understanding of sickle cell disease and improve the health outcome of those living with the condition. Specifically, our partners are from the Ministry of Health and Wellness, Doctors Tamu Davidson, who you'll hear from shortly, Kathy Ann Williams, and other directorates and executives. I must acknowledge Dr. Carol Lord, chair of the Sickle Cell Technical Working Group in the ministry. From the Sickle Cell Unit, the Caribbean Institute of Health Research at the University of the West Indies, we welcome the team who join and the members and friends of the Sickle Cell Support Foundation of Jamaica. Our special guest and keynote speaker, Prof. Jennifer Knight Madden. Prof, thank you for agreeing to give this lecture and share your wealth of knowledge in advancing sickle cell education. We're eagerly awaiting your presentation. The work we're doing is to improve the health outcome and enhance the quality of life of the sickle cell community. So wherever you are in Jamaica or overseas, I acknowledge and celebrate our sickle cell heroes. So in the chat, type hashtag sickle cell hero. So I'm looking, type hashtag sickle cell hero. We celebrate you. Members of the media, ladies and gentlemen, friends and family, it is truly a pleasure to welcome everyone who took the time to join our lecture, our main event, as we celebrate Sickle Cell Awareness Month. Thank you for choosing to spend your time with us this evening. So as you've heard, September has been officially designated Sickle Cell Awareness Month, observed to increase knowledge and understanding of sickle cell disease, ultimately to improve the care, health outcomes, and quality of life of persons affected. Indeed, knowledge is power. So in addition to my welcome, I bring greetings and a message on behalf of the Sickle Cell Support Foundation of Jamaica, a nonprofit organization founded 31 years ago by two young university students living with sickle cell, Camille Daly and myself. As a foundation, we commit to increase public awareness about sickle cell, support persons living with the disease, and create an environment in which we can thrive and realize our full potential. The theme this Sickle Cell Awareness Month is Sickle Cell Matters, hashtag Know Your Status. This theme is aligned with the ministry's focus on knowing your numbers. Why is it important to know your status? Prof. Knight Madden will certainly elaborate on the reasons during her lecture. However, to reinforce the point, I share the story of a Jamaican family. The female was aware that she has the sickle cell trait as she got tested early. She had an informed mother who told her to ensure her suitor is tested. He did, and the results confirmed that he was fine, no sickle cell trait. So they got married. To their dismay, they had 2 children born with sickle cell disease. How is that possible, you ask? He is in that 5% of our population who carry other abnormal hemoglobin traits, in addition to the 10% of the population who carry sickle cell trait and are at risk of having children with sickle cell, a total of 15% of our population. This story is not uncommon in Jamaica, and the specific incident is that of a prominent Jamaican family. Their life story changed as they experienced the challenges of parenting 2 children with sickle cell. Ignorance is not bliss in the case of sickle cell disease. What you don't know will hurt you. So, as we commemorate the Sickle Cell Awareness Month, the lecture acts as a platform to amplify some key messages. 1, 15% of the population is at risk of having a child with sickle cell disease. 2, if one parent has a sickle cell trait and the other has another abnormal hemoglobin trait, this can result in a child with a sickle cell condition. Get tested. Know your hemoglobin status. Do the hemoglobin electrophoresis used to diagnose all hemoglobin disorder. 4, early screening can improve the quality of life of those affected. And 5, people living with sickle cell disease can lead empowered lives once the stakeholders, that's the family, school, workplace, and society in general, are aware and educated. So this lecture today is so significant as it is intended to address the root of ignorance surrounding sickle cell disease and detail all we need to know about the condition, building the capacity of all the key stakeholders to positively impact the lives of people living with sickle cell. So finally, armed with sufficient information on the condition, this will certainly dispel the myths and misconceptions and create a safer space for persons living with sickle cell to live and thrive. Knowledge is indeed power. So ladies and gentlemen, welcome all. Thank you for spending your time with us this evening. Over to you, Alicia.
Thank you, Maurette. And next, we will have greetings from very 2 specially invited guests. First, we will have greetings from Dr. Tamu Davidson, Director of the NCD and Injury Prevention Unit within the Ministry of Health and Wellness, followed by Professor Monica Asnani, the current Director of the Sickle Cell Unit at the University of the West Indies. Dr. Davidson, good evening.
Good evening. So I'll start with my salutations and recognize Professor Jennifer Knight Madden, our keynote speaker, Miss Maurette Wright, co-founder of the Sickle Cell Support Foundation of Jamaica, Professor Monica Asnani, Director of the Sickle Cell Unit, members of the Sickle Cell Technical Working Group, colleagues from the Ministry of Health and Wellness, Dr. Kathy Ann Williams, the Program Development Officer within the NCD unit, which is a non-communicable disease unit at the Ministry of Health and Wellness. And of course, Dr. Carol Lord, who's not here, but who is the co-chair of the Sickle Cell Technical Working Group. Also like to recognize representatives of the Sickle Cell Working Group and its subcommittees that may be listening to this lecture today. Also representatives from the Sickle Cell Support Foundation of Jamaica, the regional health authorities, healthcare workers, persons living with sickle cell disease or persons with lived experience with sickle cell disease, and all other viewers. Good evening. So on behalf of the Ministry of Health and Wellness, it is certainly my pleasure to bring greetings at this annual sickle cell lecture in commemoration of Sickle Cell Awareness Month. This topic is very dear to my heart, having worked for a couple of years with patients living with sickle cell disease. And so was very, very committed to being here today. And so as we collaborate, and as we have been doing so all month, we and our partners are working towards raising the awareness about sickle cell disease and the importance of knowing one's status. Today's event is a testimony of what can be achieved working through partnerships. Very important. And also critical is the contribution of persons with lived experience. So persons living with sickle cell disease must have a voice in this process. In Jamaica, sickle cell disease affects the lives of many persons. 1 in 150 persons being born each year with the disease, and 1 in 10 persons being born with the trait. So sickle cell disease is associated also with a number of complications, the acute chest syndrome, painful crisis, stroke, and kidney disease. And so very fitting that the theme for this month is Sickle Cell Matters, #Know Your Status. I hope you're hashtagging there on Instagram and all the different social media platforms. So in keeping with one of our key priorities for this year, to promote health screenings through our Know Your Numbers initiative for non-communicable diseases such as diabetes, hypertension, we welcome this opportunity to continue to raise public awareness about this disease that has not only been recognized in Jamaica, but around the world as a public health priority and an NCD. It is of high importance that every Jamaican knows their sickle cell status, given the prevalence of sickle cell disease in Jamaica. And so a blood test is done on all newborn babies at birth in hospital and on pregnant women. And the sickle cell test is also available at most labs island-wide for any Jamaican who needs the test. Early detection of sickle cell disease means that the necessary prevention and treatment of the associated complications may start very early in the process to prevent or delay the onset or manage these complications. Medications and vaccinations are available for persons living with sickle cell disease and are free in the public sector at the point of care. Additionally, the National Health Fund also has benefits and subsidizes medications for the management of sickle cell disease when it's purchased in the private sector. So today's event also reinforces our commitment as a Ministry of Health and Wellness, and as all of the partners that are here today, for the meaningful involvement of people with sickle cell disease in the response in recognition of the Global Charter on meaningful involvement of people living with NCDs. This is evident in the integral role played by the Sickle Cell Support Foundation of Jamaica and our ongoing partnership through the Sickle Cell Technical Working Group. I invite you to listen carefully to this session as you're guided through important facts about sickle cell disease and all that we can do together to reduce its health, social, and economic impact on our population. So remember, check up, follow up, live up, Sickle Cell Matters, #Know Your Status. And ignorance, is it bliss? We'll find out later from our keynote speaker. Thank you.
Thank you, Dr. Davidson. And now over to Professor Asnani. Good evening, Prof.
Good evening. Stunning. Alicia, you look stunning today. I haven't had a chance to say that to you yet, as always, but better than every day.
Thank you.
Thank you so much, Madam Chair. Good afternoon, all my colleagues, my friends. I want to congratulate the Sickle Cell Support Foundation of Jamaica and the Sickle Cell Technical Working Group on hosting another one of the much anticipated annual Sickle Cell Disease Lecture. It's a celebratory feature in September that we all look forward to. As you know, September is recognized as Sickle Cell Disease Month. So everybody so well has spoken about sickle cell disease and to know certain things. Maurette, Alicia, Dr. Davidson, and of course, you're going to hear from our keynote. But sickle cell disease can be a devastating illness, and it was first identified over 110 years ago. And in the last couple of decades, there has been much knowledge and much understanding that has been gathered on responding to the challenges of this disease. It has actually been declared as a public health priority by the WHO, the World Health Assembly, held in 2006. So a lot more focus from the public health system has been on this disorder. And that has led to learning the importance of diagnosing persons born with this disease as birth. We know it's a genetic disorder. What does that mean? That means that the only way to get it is to inherit it, to be born with it. So we are born with it. So we know the importance of diagnosing persons early, at birth, in fact, to using simple but very effective interventions such as daily or monthly penicillin, so babies don't have to die in their childhood any longer, to developing novel treatments such as hydroxyurea and others, which can really, really change the face of sickle cell disease severity, to curative therapies such as bone marrow transplants and the newer gene therapies that are under investigation. A lot of work has been done and continues to be done globally. Yet, we know that there are some very, very simple and inexpensive things that need to be done that are not always done, such as finding out if I have sickle cell disease, finding out all I can about sickle cell disease, especially if I or a family member or a friend or a colleague at work has it, so I can help in every way I can in managing it, learning self-care and self-management strategies. Societies and communities, such as schools and workplaces, understanding sickle cell disease so they can provide the support that individuals will need as they learn and work in these environments, so that these individuals can really enjoy great quality of life and also achieve their maximum potentials. These and many other very important initiatives are what the Sickle Cell Support Foundation of Jamaica has successfully achieved through their strong advocacy. Jamaica now enjoys universal newborn screening for sickle cell disease. And through efforts such as these annual lectures, the foundation continues sensitization and knowledge dissemination to improve ultimately how persons living with sickle cell disease are treated in their healthcare environments, as well as how they are really treated by other community members. Today's lecture, to be delivered by the very illustrious Professor Jennifer Knight-Madden, my colleague and my very good friend, is entitled very rightly, Ignorance is Not Bliss. What we should really, really need to know about sickle cell disease. And it will deliver exactly on this mandate of the foundation. I'm really looking forward to hearing your presentation, Jennifer. So thanks once again for your invitation to be here today. And on behalf of the Sickle Cell Unit family, congratulations once again to the foundation and the technical working group on hosting yet another what will surely be an exciting annual lecture. And kudos on the excellent work that you continue to do in improving lives of persons living with sickle cell disease. Thank you once again.
Wonderful. Thank you so much for that, Professor Asnani, and thank you for joining us this evening. Before I introduce our guest speaker, though, I would like to make a special announcement that the Ministry of Health and Wellness will be giving away prizes after today's lecture. So we want you to listen very keenly. We'll be asking 2 questions, and there will be 1 winner for each question. So please listen very keenly to our presentation, as the answers to those questions will be mentioned there. We also invite you in our YouTube comments to share any concerns or questions that you may have, after which we will be, as much as possible, addressing those questions to which our esteemed panelists will be able to respond. All right, so today's keynote speaker is no stranger to us. She is a woman who wears many hats. She's a professor of pediatric pulmonology and clinical research, and is the former director of the Sickle Cell Unit and the Caribbean Institute for Health Research at the University of the West Indies. She's an active international and national sickle cell disease organizations, such as the Sickle Cell Technical Working Group, which she co-chairs. She is the vice president of the Caribbean Network of Researchers in Sickle Cell Disease and Thalassemia. She is also a part of the Sick Kids Initiative, the National Institutes of Health Data Safety Monitoring Boards for Studies in Africa, the Scientific Committee for Global Sickle Cell Disease Congresses, and the co-chair of the SCIF conferences. Did I say many hats? Many hats. She has also reviewed grant proposals for the National Institute for Health Research, NIHR Global Health Research Call 1, and the National Committee on Non-Communicable Diseases, and she also chairs the advisory panel on ethics and medical legal affairs in the Ministry of Health and Wellness. Among other hats that she wears is that of a wife, a mother of 2 beautiful daughters, as well as a member of the Christian Life Fellowship. Ladies and gentlemen, without further delay, please join me in welcoming none other than Professor Jennifer Knight Madden. Prof, welcome, welcome, and thank you so much for sparing time out of your very busy schedule to be with us this evening and to share your wealth of knowledge with us. We look forward in what you have to present tonight.
Thank you so much. I'm going to just get rid of that black box and put my talk into presenter mode. There we go. Now we're ready. So I'd like to thank the Sickle Cell Support Foundation of Jamaica for inviting me to be a part of this occasion. And I'd like to thank everybody who's on. We apologize for the late start. Today's topic is ignorance is not bliss. And it's about what we all need to know about sickle cell disease. So in many cases, if you don't know something, it really doesn't necessarily matter. But with sickle cell disease, ignorance can lead to a lack of benefit for people who are living with the disease, or even worse, harm to people who are living with the disease. All of us can play a part. So we're going to take a whirlwind tour through an introduction to sickle cell disease, and then talking to different groups. And I'm hoping that you can find yourself in at least one of these groups: the general public, teachers, employers, or people in the workplace, healthcare professionals, carriers of S and other important genes, parents of children with sickle cell disease, adults with sickle cell disease. And then I'm going to throw in something at the end about the progress in the Jamaican sickle cell disease program. Because if you're ignorant about what is happening there, you might actually miss out on something. So what's in a name? Why is it called sickle cell disease? It's because of the shape of the red cell when you look at it under a slide. So most red cells are supposed to be sort of round, but in people who have sickle cell disease, you get that sickle shape. So we perhaps would have called it banana cell disease had we named it. So it's actually, as Ms. Wright said, a group of inherited red cell disorders where most of the hemoglobin, which is the red pigment that carries the oxygen around in your blood, is hemoglobin S, or sickle hemoglobin. Now, think about this. You may have seen those pictures of DNA that have genes on them. 3 billion base pairs, 20,000 genes. One of those, not one gene, one base pair is changed and you get hemoglobin S and everything that comes from that. That guy, the mosquito, is a terrible fellow, or I should say lady. And we think that there's a connection between malaria and sickle cell disease, where in the same area where you have a lot of sickle cell disease, you also have a lot of malaria. And it is thought that having the trait, the sickle cell trait, might actually have protected against dying from malaria. And so it was something that would persist in the population. So it's a global disease. We think that as many as 400,000 babies are born every year. The majority, 85% or so, are born in Africa, and 50 to 80% of those will die before they're 5 years old. As you've heard, it's been recognized as a public health problem by both the World Health Organization and the UN General Assembly. But, whereas it started in Africa, India, and these sorts of places, with migration, it has spread throughout the world. And bringing it closer to home, outside of Africa, the highest prevalence is actually right here in the Caribbean. In Jamaica, 10% of us have a sickle cell trait. And as you've heard, 5% of us have another significant trait, whether it's C or beta thalassemia, D, whatever. So think about a class. If you have a class, a year group with 100 children, 15 of them are at risk of having an affected child. Think of your workplace. Think of all the different places you are. 15% have a trait. And this means that overall, 1 in 150 live births have a form of sickle cell disease, not the trait, the disease. So we're looking at 200 or more births in Jamaica per year. And remember, you have it from birth to death. It's the ultimate chronic disease. Now, if you are with somebody out there watching YouTube, you can shake hands. Now, how many ways can two people shake hands? If this is your blue, no sickle cell gene, hemoglobin A, and this is your S, how can you shake hands? You can do right hand to right hand, so no sickle cell, so that's our all blue. You can do my right to your left to my right. Those are children born with traits, just like the parents, or if we both give our sickle cell trait, our sickle cell gene, the baby is born with sickle cell disease. So every time these two persons with that trait have a baby, they have a 1 in 4 chance that that baby is born with sickle cell disease. But pay close attention, that same couple can have a baby with sickle cell disease, a baby with no S at all, or a baby with a trait, all from the same couple. And as we heard about a prominent family, if instead of having the S, you have a C, when you test this person, you don't find sickle cell traits. So if you do a sickle prep, you won't know that this person can have a sickle cell disease baby. And it's the same thing. If they both give their A gene, the child has no S at all, nothing. If they give the S and the C, there's a 1 in 4 chance of sickle cell disease, but this time it is hemoglobin SC. And each one can give the other gene, and so you can end up with traits. So if one child could have a trait like this parent, and one child could have a trait like that parent. So this one pair of parents could have children of 4 different genotypes. So what does it matter? Well, let me tell you something. Sickle cell disease affects the blood, and the blood goes everywhere in your body. The only place that your blood does not affect is your hair, because your hair is dead. So you tell me a part of the body, and I will tell you a sickle cell complication. Not just one, but at least one that happens acutely or suddenly, and one that comes over time and is chronic. So, whereas you can have many complications, as you've heard, the thing that you think about when you think about sickle cell disease is pain. Now, the most common is acute painful crisis or veno-occlusive crisis. Let me tell you, I don't know what to tell you it feels like if you haven't felt it. Having a baby, passing a kidney stone, chikungunya multiplied many times over. It is so bad sometimes that the only thing that can even touch it is an opioid like morphine. So this pain is in a different class by itself. It's serious pain. But apart from that, there are other things that can cause pain, as we will hear as we go through the talk. But this is one of the things I want you to remember. Sickle cell disease is variable. It's variable between people. So you can have a baby who, if we don't diagnose them, they'll be dead before they're 6 months old because their disease is so severe. And you can have a lady that toddles in at 60 because she found out that she had some gallstones, and the gallstones were black instead of white. So the surgeon said, but this must be sickle cell. And she said, well, I did have a little few pain, but it never really showed. Both are sickle cell disease. And even within one person, they might go through a period where they have a lot of problems, and then go through a period where they don't have many problems. So sickle cell disease is variable. So everything that you're hearing, don't assume that every single person with sickle cell disease is going to be the same. So what should the general public know? What is sickle cell disease? We covered that. How common is it in your community or country? We've covered that. The next thing is these infernal myths. That's the next step. Listen now, help me. If you have heard these myths, listen to the truth and make sure that you counter falsehood with truth every time you hear it. If you've heard of one of these myths before as we go through, put it in the chat. Say #truth instead of the myth. So one is only Black people get sickle cell disease. The truth is, no, that is not so, right? You see Africans, Asians, Caucasians with, light-skinned people with light eyes with sickle cell disease because it is based on inheritance of a gene, not on the skin color. Here's another one. Women with sickle cell disease are infertile, or in Jamaican parlance, are mutes. No, women with sickle cell disease are fertile and can have babies. What we need to remember is that there's increased risk of illness and death for both the mother and the infant. So we have to counsel our patients to think carefully before having babies. Here's another one. You can't catch sickle cell disease because they have the yellow eye and they have the sore on the foot, the leg also. No. The only person who can give you sickle cell disease is your parent when you were conceived. You can't catch it again, right? So all these myths are out there. Everyone with sickle cell disease will die early. They're not gonna make 25 or 30. No. The average is perhaps in the 40s or 50s, but we had a gentleman come to clinic in his bow tie and looking dapper in his jacket, in his vest. It was his birthday. He was turning 90. And the same day we had a child who was turning 9. So we got a cake. Yes, they can live much longer than you think. And finally, that sickle cell disease patients cannot hold full-time jobs. They're just going to be worthless. No, many people with sickle cell disease have different kinds of positions. You see our MC, you see our the founders of the Sickle Cell Support Foundation. They do wonderful work. So please, #truth. We're going to mash down those lies. But the other thing is how your empathy and compassion can make a difference. Wherever you are, people with sickle cell disease face this stigma, this lack of empathy. From the general public, it's hurtful when they want to tell you to get up and give your seat to somebody on the bus because you're young and strong, when in fact you have a leg also, or at the workplace, or at school or university. And it hurts me when I say this every time, but healthcare facilities from staff. But maybe the most painful is even at home. So we all need to learn empathy and be against stigma against the people living with sickle cell disease. So let me just remind us as a population before we move on, sickle cell disease is chronic, genetic, but it's not lifestyle related. It's not because you ate too much or didn't exercise or went out there and had numerous, no. People with sickle cell disease didn't choose to do it. They didn't bring it on themselves. And they may have been suffering unbelievable pain events for years before you met them. So give them a blight if they're not feeling well today. But yet, they are valuable contributors to our society. So now we're going to change gears. We're going to talk to the teachers out there, and I hope there are many on. So if you are out there and you're a teacher, you can put up your hand or say, I am a teacher. So how can sickle cell disease affect your students? Did you know that as a teacher, you can make a tremendous difference to your students' life if they have sickle cell disease? And we come to the clinic, come to the support foundation. We can tell you about the people with sickle cell disease who have done medicine, dentistry, law, human resource management, teaching, medical technology, hospital administration, nursing, science, and all kinds of fields, because they were supported by their teachers. And there are resources available to guide you. So it starts as early as the preschool, right? One of the first signs of sickle cell disease is swelling of the hands or the feet, the fingers or the toes, dactylitis. If you see a child with that, say to the parents, have you gotten the sickle cell test? But there are serious complications that can cause death in this age group. If the child is usually moving around, playing and whatever at school, and then one day they come and they just sitting quietly, putting down their head on the desk, not doing anything, call the parents, because it could be acute splenic sequestration. They can literally go from running around yesterday to dead today. It's that sudden. You as a teacher can pick it up and save that life. They will need to go to the clinic, to the health center to get their immunizations, their penicillin. And sadly, in some children, not all, you can even start to see some early learning deficits even before they start grade 1. So I've put a few points here for us to think about as we listen to one of our teachers who also is affected. So one of the important things is, although we usually talk about avoiding cold, as we go through this climate change and things get very hot, sometimes the children cannot manage the overwhelming heat also. So let us listen to our teacher. The sound might be a little up or down, so you can change yours as necessary. So we have this evening one of our teachers who has taught very young children with sickle cell disease, and she's going to tell us what she has done a little bit differently with them to give them the best chance of being the best that they can be. Please go ahead.
All protocols observed. Good afternoon, one and all. So my experience with my babies, I am a teacher. I teach from 3 to 6 early childhood education. And my babies who come to me with sickle cell disease are not really singled out, but are given a little bit of preferential treatment. Yes, I'll ensure that they stay cool, so they are always a little bit closer to the fan. They have the opportunity to drink their water as much as possible, because of course we have to keep them hydrated. Yes, as for the lesson, teaching sometimes in a whole group, they get lost. So, we have to have their activity all ready for them so that they are not feeling left out from the class. What I do, especially for my babies, is each time one of my sickle cell students go to the bathroom, I ensure that when he or she comes back, you have some water, because you just pass some urine, so you have some water then. I ensure that they have their foods. Try to have their parents ensure that they eat healthy. Good. Sometimes they'll have to stay back when school is over so that we can ensure that they catch up with the lessons that were taught and they're not left behind, because they do get what would I say now? they feel offended when they are left behind, when the class is going and they are not catching up. So we have to give them a little preferential treatment so that they catch up. The children we're all on the same level. Yes?
Wonderful, wonderful. So that
Right.
when they leave your hands, they are on par with their peers and they're
Yes.
able to move on to the next stage, doing
Yes.
very well.
Exactly. And what I do, I follow my children right up until grade 6. So when they leave my class, whatever class they're going in, I go and I have a conversation with the teacher. This child has sickle cell. This is what needs to be done for him or her. You have to ensure that he doesn't overexert himself or do too much at one time. Yes, so maybe even the physical education teacher, if you're going to give the children laps, when you give them 3, my sickle cell baby will only be able to do 1 for now, right? Sit and catch a breath, hydrate, probably. If they're up to it, they can do another one. Yes, but they are not left out and they are not overexerting themselves.
Thank you so much. I mean, you're doing a wonderful job and we really appreciate it. And thank you for sharing that today
Yes,
as a part of this lecture. All the
yes.
best.
Thanks. All right. Thank you, Dr. Good night.
Do you have any sort of doubt that that kind of teacher makes a huge difference in this child's life? What about primary school? So we're talking 6 to 11 now. We get some more common major complications like painful crisis. If they are triggered by changes in temperature, getting wet, dehydration, overexertion, infections, you can look out for these things. Acute chest is like a bad pneumonia, but it can be even more dangerous. So if you as a teacher notice that they're not breathing well, you call the parent. Believe it or not, by the time our patients get to the age of 16, about 6 to 7%, 6 or 7% of them may have had a stroke. Yes, a stroke like what your granny would get. Not talking, one side is weak. Certainly, if you notice that the child is slurring or something is going on, call the parent. But what is very sneaky is that as many as 1 in 5 children might have what we call silent infarcts. So if you do the CT or MRI, you will see it, but there is no weakness. But it can affect their behavior or how they learn. So if Johnny or Jane is going along swimmingly, keeping up, and then suddenly they're not so much, then again, have that discussion with the parents. Maybe they need to be tested. Maybe they need to see the doctor. Maybe something is going on there. Don't allow it to just stay. Bring it to the parents' attention. And then there are other important issues: jaundice, yellowing of the eye, anemia, which might make them a little bit weaker, slower growth and development, missing school and falling behind, feeling different, and of course, bullying. So, you know how it is. Children who are different are sometimes bullied. As a teacher, you can share with the class, about sickle cell disease and get them involved in really helping this person to be the best that they can be. When we go into high school now, you have even more complications because some of the chronic things are coming in. Remember, not everybody has everything, but you have to be aware. Ignorance is not bliss. So there's a penis problem that can be the end of all activity, right? So if a teenage boy comes to the teacher and says, Miss, I need you to call my parents. I'm having take him very seriously, because 3 hours can make a difference to his function for the rest of his life. Okay, we start screening for eye problems from the age of 12. But if the child has been doing fine at the back of the class and now them not seen, you have to pick it up. So the good teacher is observant. And of course, Lego says, you have children who are told by teachers, go home and come back when it is healed. So what, they're to stay home for the next 6 months? Not at all. Let them come to school. Let them actually put the foot up so it is more likely to heal. And then other problems like delayed puberty. You know, you're going to PE, you're going to the change room, everybody else have big beard and deep voice, and you look like you just came from grade 6. It can be really a problem, but it is delayed. They will go into puberty, and if necessary, we will help them. But sometimes they need, you know, that support. Body image, self-esteem. There's more risky behaviors. Professor Asnani did that work in our children. Depression and career guidance. They can be a policeman, they can be in the army, and they can do something with flying. So when you're having these career talks in high school, already you're trying to help them to choose a career that works well for them. And there are local resources. Big up St. Andrew High School for Girls. You can see one of our teachers there, along with one of our students who has since graduated, did very well. Got a lot of support at school, and so that is a booklet that's available through the Sickle Cell Support Foundation. And then there's a teacher's guide, which is in the Sickle Cell unit guidelines, which is available to doctors all over the island. They can copy that and give out to parents. So there are, and to teachers, there are resources available. And even with Mrs. Esther Tyson of Arden fame, some years ago, we wrote a paper about the possible impact of teachers and school nurses on the lives of these children. So if you're really interested, you can even get that. That was with Norma Lewis, my nurse, who actually died of dengue. We'll come back to that. So here's what I've said. Teachers who are aware and care can make all the difference. So I really encourage the teachers on the call, and if you're on, and you know, send the link to your colleagues so that they too can become that teacher that cares and is aware. Now, what about the workplace? These are a couple quotes from some of our patients. You know, there's a major issue with the inability to get or keep a job if you or your child has sickle cell disease. And one of our patients says, my worst challenge would be employment. I get job offers, but after a week I get sick. I'm not mad at the employers. I'm just sad. Another said, most employers are not willing to employ adults living with sickle cell disease because of the amount of time the individual will be absent from work during illness. Now remember again, sickle cell disease is variable. So many people are able to work well. And with the help of their colleagues, they would be sick less. So they completed school. They completed training. They have competencies. Should we write them off? All right, let's listen to an adult living with sickle cell disease who can tell us what the work environment has been like. Okay, good evening. We have with us a young adult with sickle cell disease who's going to speak to us about being employed. Please go ahead.
Hi, good evening. Thanks for having me. So far, I've been employed for a little over a year. So far, it's been very good for me, actually. I've learned to deal with the different situations thrown at me. The only difficulty I've really had is with, sudden weather changes, or even just when the time gets very cold. My fellow co-workers understand that, due to my ailment, it's mostly the cold that really affects me. So, for example, if we have the AC on, I'd say, I'm getting a bit cold, and they'd understand if I need to turn it off, or if I come in and not feeling too well, I just take a medication and I let my advisor and my manager know what's happening, and they also understand. So those things so far have really helped me gotten through with my ailment.
Great. And so you think that you're able to contribute to your workplace and pull your weight and do the work?
Yeah, greatly, because other than feeling well, I can say I give 100% of of myself in my work. So
Great.
I believe I contribute a lot.
Wonderful. So what would you say to other employers out there?
I think they should give other persons with the disease a chance. Don't just turn them down simply because they have sickle cell disease. You may never know what they can contribute to your organization, and they can do a lot beyond what many people may think.
So thank you so much for being willing to be a part of the lecture this evening, and all the best to you as you continue to work and to, put your degree and your training to good use. Thank you again.
Thank you. Thank you. Okay.
All right. So again, it's variable, but as an employer, you would need to know how can the sickle cell affect your employees and how can you make a difference to their life as they're there working. So now we're actually going to listen to the last of our audios, which is a supervisor of somebody working with. We're joined this evening by a supervisor in the workplace of an adult living with sickle cell disease. Welcome and thank you for joining us. Please go ahead and tell us your experience.
Good evening, everyone. I'm very happy to be here this evening to share my experience thus far working with a member of my team who has the sickle cell disease. When this team member started out, I had a meeting with her because I was aware that she had the sickle cell disease. And one of the first things that I shared with her is that she should be free to communicate with me whenever she's feeling pain, whenever she's not feeling well. And that, I think, causes her to be felt very accepted. And so whenever she goes to the field, I ensure that I encourage her to have her water because I realize how important it is for her to be hydrated. And also as it relates to field work, for her not to go to field 2 consecutive days. So if she goes out on a Monday, the next time she will go out would likely to be a Friday. And why Friday? Because she would have the weekend to recover. Also in office, the where she sits is away from the AC because, again, I'm aware that when it gets very cold, it might causes her not to feel well. So as it relates to the office environment, we ensure that it is as conducive as possible and for her to feel very valuable and very normal. There are times when she would ask permission to come in late because she will wake up in the mornings and she's not feeling well or she's in pain. So as it relates to her productivity, she does as much work as those officers without sickle cell because one of the important things that she has never allowed her disease to stop her from producing. And apart from work, she participates in everything that we do. We have periodically times where we just meet and have end of month times, and she will be a part of it. And if she doesn't say or indicate that she has the disease, unless you are very observant, you would not know. And so I'm very happy to have her as part of the team. She's a hard-working officer and she's very productive and she acts very normal. And I would just want to just encourage those employers or those working with persons suffering with sickle cell disease that for me, one of the biggest things is to let them feel very accepted and to let them know that they are as productive as other members of staff. And so I'm very happy to have her. and I'm looking forward to a continued good working relationship with her. Thank you.
Thank you so much. We really appreciate your input and hope that many prospective employers out there are listening, and we will be willing to give other people living with sickle cell disease a chance to become a part of their team. Thank you so much. Okay, now, so we've done teachers, we've done the workplace. We're going to very quickly do healthcare workers. Yes, you need to be willing to be trained in terms of being capable. But what I want to emphasize, again, empathy, compassion. You have the opportunity to care for people with sickle cell disease. I hope you're becoming more motivated to do so. But what we really need is some champions out there. So be a champion for persons living with sickle cell disease. So we want a medical care home where the person living with sickle cell disease is at the heart of it, and where everything is provided there, from diagnosis, referral to the home, and then access to hydroxyurea and freedom from stigma there. So that's all I'm going to say about healthcare workers, because we have lots of, sessions with you. I'm going to go to the carriers of the S and the other important sickle cell disease genes. Hashtag know your status. We know that 15% of Jamaican adults are at risk. They have one of these genes. And that the risk for your child is also determined by the status of your partner. But do you know your status? Do you know your partner's status? And do you know your children's status? Every Jamaican should. Because the only way that you know your status, the only way you know your risk is by doing a blood test, which is easily available. Feeling well does not mean that you don't have a trait. Feeling well does not mean that you can't have a child with sickle cell disease. Let me tell you, at the clinic, we see these very shocked patients, these parents, when their child is diagnosed. And in fact, we even did a study at the university, and we found that most of the students did not know their status, but they were entirely sure that they could not have an affected child. So, hashtag know your status. Remember, it's inherited, and you need to do not just a sickle test, but an electrophoresis, so they will look for the other genes. Do you know which one you are? So we have the hemoglobin A gene, the normal adult gene, the hemoglobin S, the hemoglobin C, and other variants. You could be any of these. This person down here who has 2 hemoglobin A genes is the only type here that cannot have a child with sickle cell disease. If you have a trait, whether it is with another variant, with a C, with an S, you can have such a child. Certainly if you have sickle cell disease, whether it's SF, SC, or with another variant, you don't have any A to give. All your children will at least have a trait. And if your partner has a trait, it's a 50-50 chance of sickle cell disease. So know which one you are. Now, for the parents of children with sickle cell disease, most children born with sickle cell disease in Africa die before their 5th birthday. It's not so in Jamaica because we don't have malaria and probably our healthcare is better. But 40 years ago, 1 in every 5 infants born with sickle cell disease would have died, SS, before their 5th birthday. Now, children in Jamaica who are screened at birth and join the clinic have the same chance of living past their 5th birthday as any Jamaican child. Yes, man, you can clap in the chat. That is a big thing, right? That we are ahead of many other low and middle income countries. Why? Because of this medical home, this ambulatory care site. And all we do, a lot of what we do is just talk to the parents and to the children as they get older. Information about sickle cell disease, plans of how to deal with complications, plans of how to deal with pain. Talk about hydroxyurea. Say, this is when you go to the hospital. If you say this, straight to hospital. and review how to treat pain, but we also do screening. We treat for complications. So you'd say, this is a good thing. Why wouldn't parents bring them? So no, there's so many things. We talked about the immunizations. The Prevnar costs somewhere between $15,000 and $25,000 for one. If the child has sickle cell disease, the government gives 4 for free, but you have to have brought them to the clinic. They get a free Hib. These things, they get put on penicillin to stop them from dying from bacterial infections with pneumococcus. You saw the slide already. The parents are taught how to feel this for the spleen so that the child does not have sudden death. And we can actually do ultrasounds of the blood vessels in the head and determine if the child is at high risk of stroke and put them on medication. You would say to yourself, oh yes, I would be there with my child. But yet, not all come. And what were some of the barriers? They say, well, the other children didn't have sickle cell disease, but you know, because you're not ignorant, that the same couple can have a child with sickle cell disease trait and no sickle cell at all. They say, well, the child looks healthy. Well, they can look healthy today and be dead tomorrow. And funny enough, denial didn't stop them from coming. But sometimes when they came once, the cost of transport and work conflict became an issue. But you know what helped them to come? The auntie or the granny at home that said, yes, man, take the child to clinic. Having the best interest of the child at heart, multiple calls and reminders from the clinic, and knowledge of their own sickle cell status. And if they were a little late, just a little late, 5 months instead of coming at 2 months, they had more acute chest, which is a serious pneumonia, and more painful crisis. 43% more acute chest and 40% more painful crisis by the time they were 5.5, just because they came after 5 months of age. So ignorance is not bliss. While you're staying home waiting to come, your child can have more complications. So bring them. Now with the adults, sometimes they start to get tired of this, especially the young adults. The parents not taking them anymore, so they're not coming. Please encourage them. That young adult time is a time when we lose a lot of patients because they stop getting care, but they still need the anticipatory guidance. They need the screening and they need the treatment of complications. I'm going to show you a few. Look at that hip. What happened? They had painful crisis in the hip and the hip got soft. So the weight, instead of being nice and round, pressed it down and now it's flat. So you have a flat in a round socket. That is pain every time you move. That didn't have to happen. Blindness, leg ulcers, and this is the best picture, the least objectionable picture I can get. They can be terrible. We've had people literally commit suicide because of leg ulcers. So adults need to come so that they can get care. Kidney failure. We don't want people on dialysis, but it happens. And of course, I mentioned priapism. That's a purposeless, painful, prolonged erection. If it persists several hours, when it goes down, it may never get up again in life. That's the end of that story. That is the opposite of bliss. That ignorance is not bliss. It's really bad when you see these men who didn't know and so end up like this. Ignorance is not blissful. Just want to say dengue is around. We're having a dengue epidemic. If you have sickle cell disease and dengue, you are more at risk of death. So in the last epidemic, more people proportionately died of dengue who had sickle cell disease, and more people with hemoglobin SC, which is a milder type than this more severe type SS, died with dengue. So please make sure that you are avoiding mosquito bites. Do not be ignorant about this. And finally, coming to the end now, the wonderful thing is that sickle cell disease is included in the National Non-Communicable Disease Strategic Plan. And we have a technical working group led by Dr. Lord. I'm the co-chair with people from all the regions, both of the labs. We have our patient representative, people from the unit, and this has made a tremendous difference. Look at this. We're in the plan. We're in the new plan. We have island-wide screening, newborn screening, all public hospitals by 2015, all private hospitals by 2020. Not to say we don't miss a few, but we try to find them back. We screen more babies in Jamaica than some huge African countries with higher prevalence rates than us. This is a big win. Big up to the Jamaican Sickle Cell Disease Program and the Ministry of Health. We've had access to train healthcare workers. Our trainings are on the NCD website. So all healthcare workers out there, if you want to be trained on sickle cell disease, all you have to do is log in to the NCD website and you can see everything you need to see. Pneumovax is now free. We're on NHF list of subsidized diseases, and they even added in more drugs in 2021. So if you're out there and you have sickle cell disease and you don't have an NHF card, please get one, because sometimes you can't make it to the public hospital and you need to go to a private pharmacy. And patients being treated at the sickle cell unit now get their sickle cell drugs for free through the government. So lots of policy wins that can change lives, right? And this is the difference. We're not in the silos anymore working by ourselves. We're all working together. Lots of our colleagues abroad are actually quite jealous of how well we work together in Jamaica. And we're continuing to press forward. The passport is coming, the audits are approved. There are other things like patient videos that are coming out. So listen out and learn about them as they come out, because they're very exciting and they can change lives of people with sickle cell disease. So the sickle cell unit is not an ivory tower up at the university. We are a source of light, but that light is spreading all across the island to help people. But that light is not just healthcare workers. That light is teachers, employers, members of churches, members of service groups, all people working together to improve the lives of patients. So Africa, some places in Africa are like here. They do localized screening and a little bit of care around a hospital. We are universal. Penicillin is available, vaccines available, and all of that. We want to move to using hydroxyurea more widely, because hydroxyurea is a drug that improves the life of most people with sickle cell disease who take it. And we don't know why more are not taking it. And so we're doing a study, help us with that. And then there is the cure. And we've actually participated in trials about one of the cures. And we're very excited that it's coming, but it's still down the line. So be a part of the ongoing study on hydroxyurea. If you're a patient, a parent, a guardian, a nurse, a pharmacist, a physician, please participate so that we can know how to help you to use hydroxyurea more. And you've seen this already, but it's a little bit different. It's a little different because if none of us are ignorant, then our patients with sickle cell disease will be better, because there'll be universal awareness. There'll be educated teachers and employers. They will have freedom from stigma. They'll be more active in more churches, service clubs, and other areas, so that they're a part of the national agenda. I am inviting you to be a part of this provision of person-centered care, not just healthcare, but care in that larger sense, because you're no longer ignorant. And so you can actually be a part of the change. So this is our model for success. Everybody together, lots of passion. Sickle cell disease matters. Hashtag know your status. Thank you so much. Okay, we just had slides real quick. Okay, Thank you very much. That is my talk. Thank you.
Yes, thank you for that very, very, very informative presentation, Professor Madden. I really hope that persons have been paying attention. We hinted before that we have some special prizes coming up soon, but we also invited persons to listen. If there's anything that you heard that you weren't sure about, feel free to put your questions. And now is the perfect time to put your questions in the chat, questions or maybe other comments that you may have, anything that you're not certain about. This is an open forum that we have just a few minutes before we wrap up, but we invite you to post any questions that you have. This this event is about information. It's about dispelling the myths. It's about not being ignorant. Ignorance is not bliss. So if you have any questions, feel free to shoot them right now before we go ahead into our spot price section of the program. There was one person that has noticed so far that had a question and a comment that was from D_original cash can. That person, well, they mentioned that possibly if we could have more sessions, I'm guessing for the healthcare workers, I'm guessing at the Falmouth Hospital, perhaps there wasn't a good experience there. Doc, can you speak to if you, or the team rather, has done any sessions at the Falmouth Hospital specifically?
We have done sessions in all of the regional health authorities, and we have done online sessions. So I have been down to the Western region several times, and we are always willing to involve people in more training, but we also want people to make use of the training that's there. One of the things that we are planning to do is to have in each region a clinic where at least once a month they would see sickle cell patients. That's one of the things we're working towards. We don't know when we'll be able to put it into practice. So then we would sort of do intense training with those people, and then people wouldn't have to leave from their region to go far, but they could, within their region, find a clinic for adults and a clinic for children. So that's in the pipeline. We're working on it.
Mm-hmm.
But I'm sorry for any bad experience that they had. And, you know, we used to do a country clinic in Black River and a country clinic in Montego Bay. And we thought that really what we need to do is to pour ourselves into educating more people, so that even on the days when we're not there, the standard of care continues to rise. And the Ministry of Health has been a wonderful partner in facilitating that.
Right. Yes, that is true. And right, we have identified the need for it to be widespread throughout the island in each parish. But I can assure you that the team has been working assiduously over the years. It's not where it needs to be, but they have made quite a significant stride in, you know, transferring this information, spreading the information about sickle cell disease. As you may also be aware that, you know, with the turnover rate in some of our healthcare sectors, persons who may have been prior trained may have gone on to a different institution, etc. So it's an ongoing work, and they are working towards that. So thank you for that response, Prof. We also had, from that same viewer, had a question about employment. Lucky for us this evening, we do have a HR professional on our panel. Maurette, I'm going to call you out if you're still available with us. The question was, can an employer terminate or reject your employment because you're a sickler? Maurette, are you available to address that question?
Yes, I can. Yes, I can.
Thank you.
So that would not be the basis for termination of employment. That would be sheer discrimination if that were the basis.
All right, there you have it, to the point. So essentially, no, they should not terminate you or reject your appointment, because that is a basis for what we refer to as discrimination. So that's a part of knowing your rights. So you can get further information from the ministry and know that, you know, based on what we have discussed here, that should not be a basis. And Prof has identified that persons with sickle cell can lead fulfilling lives. We are very hard workers. We can contribute to society just as much as the other person. So that is not a good basis for rejecting employment. Let's see if we have any other question. Prof, I can tell you that it's been very engaging. A lot of persons have been enjoying your presentation. Many persons commenting that it's very informative, awesome presentation, excellent session. So that's great. I saw a question somewhere. Where was the question? So the latest one was from Merton and Sobers. How can a person with sickle cell disease raise their hemoglobin level?
You know, that's an interesting question because you don't necessarily want to raise it too high. Because the blood of somebody with sickle cell disease is a little bit more viscous. And in fact, if the blood count gets too high, you might be at risk of having a stroke. So you don't want to raise it too high. Now, sometimes it gets so low that the person has no energy, usually when there's renal failure. And at that time, sometimes we have to use transfusions, and sometimes we have to use medication to try to build back the blood. But what you do not want to do is to use iron, okay?
Right.
We do not encourage people living with sickle cell disease to take iron supplements because they sometimes do get blood transfusion. And remember, men don't have periods, so they have no way to lose the blood. And you can actually get sick from having too much iron in your body. That happens a lot in some people who have had many transfusions. So don't use iron, just eat a healthy diet. And if you're finding that, we find that your blood count is going down, 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 then we have to do some screening for your renal function, your kidney function, to see if that's where the problem is and see what we can do about that.
All right, thank you for that response. I also just learned something. I did not know that it could be dangerous to raise our hemoglobin level too high. So that was very informative. Thank you for that response. The same viewer, Mertland, had also asked previously about where to get treatment for leg ulcers. One of our panelists has responded to that to say that most primary healthcare facilities offer treatment. So you can reach out to your healthcare department in your parish, and you can also go to your private practitioner for care, and as well as the sickle cell unit at University of the West Indies if you would need treatment on that. So depending on where you are in the island, you don't always necessarily have to travel to Kingston. Your local parish healthcare department should be able to assist with the treatment and the treatment of the leg ulcer. So we hope we had answered your questions, Mertland. Anybody else had any other questions before we move to wrap up? Okay, so Mertland said thank you. So yes, you have answered the question satisfactorily. All right, so should we proceed into our prizes? Let's see who has been listening very keenly throughout the presentation. Where are the questions? And Dr. Williams, are you going to be on to assist with selecting the winners for our prizes?
All right, I'm right here looking out.
Awesome. Okay, so Mertland says they're living in St. Lucia. So we have viewers from all over the world. So that's wonderful. Thank you for joining us. All right. So let's go on into our spot prizes. Oh, well, no, we had another question before we get into that. So the question is, why can't someone with sickle cell fly on a plane? That's a myth.
It's not that they can't fly on a plane. We have patients that go all over the place, right?
Mm-hmm.
But what is the problem is working on a plane, because you know that planes are pressurized to a certain level, but there's always a possibility of the oxygen falling. And because of how the sickle cell hemoglobin deals with oxygen, that would be more dangerous for somebody with sickle cell disease. And so the airlines are not likely to hire people who have sickle cell disease because of the risk that might be involved in prolonged flying. Because you know that the higher up you go, when you go on the mountaintop, the air is really thin, so there's less oxygen up there than down here. And so because the barometric pressure is less. And so you don't want to be putting people with sickle cell disease in a situation where they're having prolonged and recurrent exposure to possible exposure to a lower oxygen level.
Right. Yeah, so I hope that answered your question. That's the real flex. I posed that question. So it's not that we can't fly in a plane. It just depends on the frequency. For example, someone who is in the airline industry and air hostess, a pilot, etc. But persons living with sickle cell can travel regularly via plane.
And if you love planes, learn to fix them.
Exactly. That's an alternative. You can be an engineer, other different opportunities there. All right, Dr. Williams, are you ready for our first question for our prizes?
Yes, I am.
All right, this is very easy. This is so easy, and everyone here should know that. If you didn't know that before, you should definitely know it because it was mentioned more than once tonight. So the first question is, are you ready? How common is sickle cell disease among live births in Jamaica? So I'm going to repeat. How common is sickle cell disease among live births in Jamaica? So Dr. Williams will help me to identify the first person with the correct answer, and we will announce the winners afterwards.
I'm looking out. I'm looking out.
All right, I think we had, while we're doing that, there was another.
The real flake, yes, there we go. Real flakes, 15% is people with a trait, but not the disease.
Right.
So the hint is, if I may, through the moderator, I'll give a hint. It's 1 in.
So we're looking for a ratio.
So all of those people are talking about traits. This is not the trait. There we go.
There we go. That's Michelle Flinch.
So Michelle Flinch, congratulations. You're the winner for our first spot prize. So the correct answer is 1 in every 150 live births in Jamaica have sickle cell disease. So congratulations, Michelle. Thank you for listening keenly and responding. All right.
And I'm typing in my info. I'm typing in info so that she can send an email with her details to come and collect her prize from the Ministry of Health and Wellness next week.
Wonderful. All right, I think I had spot another question somewhere. All right, we spoke about this in the pain symposium. What to do if a healthcare worker refers to you as a drug addict? It's very common, unfortunately. Prof,
it's very difficult because what I don't want to advise is anything that's going to put you in conflict with the healthcare worker, because you have to go back there again when pain and other complications, but you just have to be very calm, very measured, and explain that it's not that you're an addict, it's that you have a disease that's causing pain. And, you know, if it's a junior doctor, you might want to, you know, speak to the more senior staff about what is happening. But you have, you know, it's difficult because you're gonna have pain again and you're gonna go back there. You can also send in some details to either the Warriors in the West or the Sickle Cell Support Foundation, so that we could, you know, try to discuss with the Ministry of Health what is going on in a particular facility, so that we can, you know, earmark them for training going forward, inviting them to come to training.
Right. That's essentially it. I mean, it is hard because you don't want to cross them the wrong way because they are, you know, your healthcare providers, and in some instances, we are at their mercies. What is important is for you to pretty much have your documentation, you know, maybe previous doctor visits, etc., and just to explain to them that, hey, this has been happening to you pretty much for your entire life, and more recently X amount of years, and this and this and this is what you've been prescribed before, and you found that this is the drug that works for you best and, you know, quickest. So it's not that they perceive you as an addict per se, but they sometimes have protocols that they have to follow as well, so that they don't just jump and go to the heavy artillery, aka the heavier painkillers. All right. I do see our colleague from the foundation, Noel, that you've been mentioning a link that persons can click on to join our foundation, but I don't see the actual link, Noel. So if you can, please post that link. All right. Further delay, none of that. We're going to go into our last spot prize question for tonight. This is also very easy peasy, but it will definitely show who really has been listening. So this question, looking for 2 answers. There are several here, several possible answers, and we just need just 2 out of many. The question is, are we ready? The question, second and last question for tonight is, name only 2, let's rephrase that, name 2 possible complications of sickle cell disease. Prof mentioned them earlier. Many of us should know them by now. There's a long list. 2 possible complications, and post both responses in one line so we can quickly pick you up. 2 possible complications of sickle cell disease. Let's go. And Dr. Williams is continuing to help me look out for. So remember, we need 2 persons.
Okay.
There you go.
So
All right. SKA Destix. Correct. All right. Denise, just a little bit too late. We already got a correct answer. So good. Persons have been listening, and I see persons here are informed. So the winner who responded first, where is the person? What was the response? Priapism and acute chest syndrome. So yes, those are 2 common complications. And yes, Denise, priapism and leg ulcers as well, pain and stroke. Wonderful. So the winner for that question will be SKA Destix. Hope I'm pronouncing your name correctly. So thank you all for your participation. And Dr. Williams, you'll be contacting these persons, or
yes,
putting your contact information.
Yes, I've asked them to share it to the email address. I can just say it here to help. Kathy-Williams@MOH, right? It's there in the chat, .gov.jn.
Oh, I'm not seeing that. Can you repost that, please? I'm not seeing. Okay.
Sure. So the email address for those 2 are 2 winners. It's CATHI-ANN.williams@moh.gov.jn. That's my email address. And I've typed it in the chat, and I've typed directly to the 2 winners. So maybe you can just confirm in the chat, if you will, SKA Destix and Michelle French, I think it was, that you would have gotten that email address, and I'll look up for the email so we can inform you on how to collect your prize from our offices. Thank you so much.
All right. Thank you, Dr. Williams. All right. So this was a lovely evening, and I thank everyone really and truly for participating, for listening. I can see clearly from the chat that persons have enjoyed this session and have learned a lot. And so it has been such a wonderful time. And at this time, we're going to wrap up. I don't know if anybody else had any other questions or concerns. Pretty much the same that we've spoken to before. We need more trained healthcare workers, which we've identified. And as we mentioned before, that's an ongoing initiative that we continue to try and spread the knowledge across our healthcare providers throughout the island.
Sorry, just a minute. It seems like YouTube isn't recognizing the link in the chat, and it may be the same problem with the
email address,
because the email address is not coming into the chat. So Dr. Williams, you could just say it slowly again.
Or can you share your screen? Well, could you stop sharing your screen possibly, Prof? And maybe she could share her screen with it, possibly. That might help as well.
Oh, that might be a little bit tricky. Type it on a blank screen. I'll dictate it as quickly as I can, as slowly as I can. So it's C as in cat, CATHI dash ANN dot Williams, that's WILLIAMS, at MOH, that's Ministry of Health, MOH, dot GOV as in government, dot J as in Jamaica, M as in Matt. I typed it in the chat. I really hope it does come up. And we've noted your handles, so we will find you. That much I can say. We will find you.
Okay. By any chance, do you have well, that might be tricky, to give a contact number in case it can't get through to you via email?
Sure. You can call 876-633-7924. That's 876-633-7924.
All right, wonderful. So there you have it, Michelle Flinch and SKA Destix. Contact Dr. Williams for your prizes at the Ministry of Health and Wellness. And again, it's Kathy-Ann.Williams@moh.gov.jm, or contact her via telephone 876-633-7924. And it's Dr. Kathy-Ann Williams. So thank you for that. Pretty much it's 8 p.m. here in Jamaica, so we're going to wrap up. But we want to just say really, really thanks for everyone who participated tonight. I can certainly see for myself that we still have persons responding to the questions who joined us, but at least it shows that you've been listening nonetheless, so that's good. So we hope that persons learned something new from tonight's presentation and that we're one step closer to eradicating sickle cell disease. Oh, you got your screen shared. All right, so I'm going to pause for a bit. So viewers, Dr. Williams has shared her email address on the screen, so you can go ahead and make a note of that. Wonderful. So Professor Madden's presentation tonight has identified the need for a community or a person-centered care approach to winning against sickle cell disease. So from family members, friends, your neighbors, teachers, employers, healthcare workers, and most importantly, ourselves. As we said, hashtag know your status. Ignorance is not bliss. We have to get involved. We need to be aware of this very prevalent illness so that we can stamp out the different misconceptions, the different myths, and help persons mitigate lives against this illness. I want to say a special thank you for all tonight's specially invited guests who've been with us tonight. A very special thank you to Professor Jennifer Knight Madden. Wonderful presentation, very enlightening, informative, very interactive. You know, those little voice clips really help to bring across your presentation even in a more enlightening way. All of our special invited guests on our program tonight, my colleague Moret, who you heard from earlier, Moret Wright, co-founder and vice president, Dr. Davidson at the Ministry of Health and Wellness, Professor Aznani, and Dr. Williams, of course, my co-spot prize moderator. Thank you all for joining us and to be a part of this program. Ministry of Health and Wellness, of course, tonight's program would not be possible without your continued support and partnership with the foundation throughout the years. A big special thanks to the PR team and to the IT team. We had some glitches, but we worked it out. The PR team also helped to get the word out and to get, our viewers on tonight to help stamp out the ignorance. We also want special highlight to the Sickle Cell Technical Working Group. They've been very busy behind the scenes. Professor Madden highlighted all the work that has been done, all the work that is to come. Still a far way to go, but they still continue to work at it vigorously. The entire team at the Sickle Cell Unit, it's a very special place for me. The doctors, the nurses, all of the team there, and the Caribbean Institute for Health Research Care. Big up to everybody there, that's what I can say. We also want to say special thanks to Miss Andrina Davis, who also helped with our graphics for tonight's program, and all my colleagues at the Sickle Cell Support Foundation, or my exec members and the team members, everybody who's watching. And of course, all of our viewers, thank you for sharing your night with us here Thursday night. We had a very wonderful program. Congrats to the winners of the prizes. I hope you enjoy your prize when you get them from Dr. Williams. And I just want to say a huge thank you. It was a wonderful night, and take care wherever you are. Keep safe and be blessed. Does anyone else want to add anything else before we wrap up?
Good night.
Good night, Prof.
Thank you, everyone. Great night.
Thank you and good night. Great job, Maurette, Alicia, Foundation, Kathy Ann. Thank you.
Thank you, Prof.
Thank you, Prof.
Bye.
All right. Good night, everyone.